Yes, ma'am.
Congressman Cassidy, I'm Gwen Davis, one of your patients, and I'm concerned not just for myself, but when I was diagnosed with a terminal illness, 95% of the people had never heard of it. My concern is I've received the treatment. Of course, there was no one to regulate what the hospital charged, which went over $1 million. If the government was going to control my health care, do you believe, or any of you here believe, that I would have been allowed to live? I am a valuable person to this community because I speak for the doctors that took such good care of me, but here I have found myself in a dilemma also, like the young lady up there. I'm on Humana now because we could no longer afford the extravagant insurance premiums. My health now, although I do receive regular visits just about every week now, my concern is, where do I stand now with my care? I understand that they can decide what treatment I receive and what treatment I don't receive. And I'm not by myself. There are other people with terminal illnesses that have found themselves 65 and older. What chance do we have?
Well, a couple things. There's actually some things that everybody in this room would agree on. The frustrating thing about the reform package that's been put forward, there was low-hanging fruit. Whether you're left of left or right of right or somewhere in between, there are stories that we all want to address. And it could have been done. So the frustrating thing for me is instead of going after the low-hanging fruit, fixing Medicare and Medicaid, and then working on the things we have in common, is there's tried to be a complete overhaul with a 1,000-page bill. So some of the things that could really work is something called modified community rating. But let's just say that everybody in a certain age range pays the same amount no matter what their health condition. My wife was a breast cancer surgeon. She's retired. But she had a patient whose husband had died or left her, I forget which, had a lump in her breast, didn't have insurance, couldn't get it, didn't know how to access care, and didn't see my wife until the cancer was growing out of her skin. Now that shouldn't be. She should be able to get insurance and pay what all folks within a certain age range would pay. Now there's going to be some subsidy of the healthy for the unhealthy, but sooner or later we're all at risk to be unhealthy, so it all balances out. And that is the sort of reform that both parties could have agreed upon. And in a case such as yours, that would allow someone who's got a terminal illness to spread those costs among many. And so I do think that reform has to happen. I am not against reform. I'm against this reform.
I was listening to the news this afternoon, and they were talking about the Weathermen underground movement. They were talking about the two guys that co-founded that. That was a movement back in the 60s, and it was not good. Harry Reid gets on TV and brags about one of the founders of the Weathermen helping to write the health care bill. Who is writing the bills in Congress?
On this particular bill, there's a fellow, you can Google his name, nice fellow, Jacob Hacker. He's a political scientist at Yale, and he's the one that came up with the idea of the public option plan. Now, if it seems odd that a political scientist at Yale is rewriting 17% of our gross domestic product, welcome to Washington, D.C. Okay? Secondly, the folks that are writing that bill are 4 to 5 committee chairfolk, men or women, 4 to 5 of them with their staff. Now, this is not 435 congressmen and congresswomen taking the wisdom of folks who've got real-life stories, who are pharmacists, who have had impacts with Medicare. This is not your wisdom. It is that of 4 to 5 people. And these 4 to 5 people have been personally picked by Nancy Pelosi. Now, if it seems like the bill that came out does not reflect the mainstream of America, that's because the people that wrote it are not the mainstream of America. Yeah. They are, to quote a White House aide, the left of the left. Now, that's not a place to begin looking for common ground. Now, I agree. I hope that this bill is defeated, and then we come back and we come up with a bill that does have common ground, that does address issues such as Ms. Davis and this woman back here, and that is something that we can, at least 95% of us, or make it 65%, can actually support, something that is sustainable. So let me just pause now and say a couple things. I want to thank this parish and you for coming tonight. This is democracy in action. And I am humbled by your concern for our country and for this issue. Secondly, I want to thank Parish President Mike Grimmer for being my host tonight and on multiple occasions. I know about your issues from all your elected officials, from you, but most particularly from Parish President Grimmer, who has just sat down with me and talked to me about your issues. He is serving you well, and he serves me well in terms of educating me as to what is important to you. And lastly, but I also thank all these elected officials because all of them are meeting with me regularly and are patient to take my call when I call them and say, Mert, what about this? Bodie, what about that? Rogers, etc. And lastly, I just want to say that I'm incredibly privileged to be your congressman. Not because I think it's a big deal to be a congressman, because I think it's a big deal to represent you. I thank you for that privilege, and I hope whenever I retire, or maybe voted out, I'll look back and I'll say that I did you right. That is my goal. If I do you right, whatever happens, I'll hold my head high. Thank you very much for coming tonight.